Hello everyone, in this video we are going to discuss about Clostridium tetani. This Clostridium tetani is a gram-positive bacilli and it is an obligate anaerobe. So it needs strict anaerobic environment for the growth, and it is a spore forming where there are terminal spores. The spores will be present at the edges. So because of this terminal spores, it gives an appearance of drumstick or tennis racket appearance, as we can see in this picture, which is a gram-positive organism with terminal spores. So this organism, whenever there is a wound, there is entry wound, and this wound gets contact with soil or dust or animal feces which is containing the Clostridium tetani, such as conditions like deep, dirty and anaerobic environment like condition, this organism will enter the body, and finally in this anaerobic environment there will be generation of the spores, and finally this vegetative bacteria will enter the body and causes toxin production. Toxins are of two types, that is tetanospasmin and tetanolysin. Tetanospasmin is the important toxin. This is a neurotoxin, and this toxin, through the entry wound, it will reach the spinal cord through retrograde axonal spread. So this is a neurotoxin which is entering through retrograde axonal spread, and it will inhibit the GABA and glycine, which will cause relaxation. That is the neurotransmitter which causes the relaxation. So because of this, there is more spasms because of inhibition of these neurotransmitters. So it will be spastic paralysis causing trismus, opisthetonus and painful spasms. The second toxin is tetanolysin. This is oxygen labile similar to streptolysin O. It is a hemolysin. As the name suggests, it will cause cell lysis, and also it will cause local tissue damage which helps in the spreading of the organism, but no neurological symptoms will be caused by tetanolysin. So the most important toxin is the tetanospasmin, which will cause all the symptoms in the patient. The clinical features are trismus, where there will be lockjaw. The patient will not be able to open his mouth normally. When it affects the facial muscle, it's called rhizus sardonicus, where there will be sardonic smile because of the facial muscle spasm. And in severe conditions, there will be severe arching of the back because of spastic paralysis. So anywhere the organism will cause a spastic paralysis of any muscle which is affecting. In severe conditions, it can also affect the respiratory system and cause respiratory spasms, which will need oxygen support. Diagnosis is mostly clinical. The treatment is to neutralize the toxin by tetanus immunoglobulin, and to inhibit the bacteria by metronidazole, and control the spasms by giving diazepam, which cause relaxation of the muscle, and supportive care in case of respiratory spasm by giving the oxygen to the patient. So these are the important points in Clostridium tetani.